May is Mental Health Awareness Month, and our goal is to bring you a better understanding of resources available for those who need them in the Valley. This morning, we're talking with Lori Chris, the director of the Ohio Department of Mental Health and Addiction Services. Good morning, Lori.
Good morning. Thanks for having us.
Thank you so much for joining us this morning. I know we should definitely start with how mental health has been brought to the headlines, of course, with the recent passing of Nicole Hudd and as we've kind of navigated through the pandemic. Do you think the conversation of struggles is more accepted right now than ever before?
Mental health and the challenges with addiction and substance use disorders too are definitely something that is getting more attention in the media and in public conversation. I think people are more willing to talk about it at a certain level, but there's still a lot of shame and stigma at the individual level or the family level that keeps people from getting the help they need.
And when we talk about shame, I know we see that a lot, especially with our men, right?
That's right. We know that men of all ages are more likely to die by suicide than women, and often they aren't as able to talk about stress or willing to talk about stress or their mental health and get the help that they need.
Speaking of stress, stress is a big factor that can affect mental health. Can you tell us about stress first aid? What is that?
Yeah, stress first aid is a time-tested, evidence-based tool that helps people recognize where they are on a stress continuum from I'm feeling great to I'm in crisis and I need support. And it's a quick 30-minute video someone can watch to better help themselves or help other people that they care about in their lives, whether it's a family member or a coworker, recognizing those signs of stress and then knowing what to do to take action to get support.
So what can we do? What are some of those ways, different ways that we can manage stress in our day-to-day lives?
Often people around us recognize the stress that we're experiencing before we do as individuals. And so watching for those signs in ourselves, the irritability, the sleeplessness, the inconsistency in our performance or mood swings, and then taking the time to stay connected to people who care about us, do things that we enjoy, whether it's reading a book or exercising, always eating right, sleeping well, and getting outside. Science shows that even 15 minutes outside can really boost our spirits and help us feel better.
Wow, great advice. Now, can you share some signs that it may be time to get some help? I know that we kind of want to put things off and say that we're okay when sometimes we're really not.
Often people will start to, lose sleep because they're worried or, ruminating on thoughts, or they will sleep too much because they're experiencing depression. Sometimes we'll see people change their eating patterns or start to act more aggressively, maybe in their relationships, maybe in their driving or in other parts of their lives. So all of these signs where someone starts to, behave less healthfully and less like themselves normally are times where we should step in and ask if they're okay. And if they're not okay, help them either, do one of those things that can promote their mental health or connect to a professional for a conversation and good next steps.
And Lori, before I let you go, please share with us those resources that we have available here if we're dealing with a mental health crisis or if we know someone who may need help.
Absolutely. Well, we have a couple of resources that are statewide, the Ohio Care Line, and the number for that is 1-800-720-9616, 24 hours a day, 7 days a week, confidential conversation with someone who can help, or the crisis text line and chat 740, the crisis text line, and you can connect with the crisis text line by reaching out to 741-741 and texting the keyword for hope. Those are both good resources. And locally, always check in with your Alcohol, Drug, Mental Health, and Recovery Services Board. They have a list of resources and supports that can help as well.
Perfect. Lori Chris with the Ohio Department of Mental Health and Addiction Services. Lori, thank you so much for joining us and sharing that great information with us. I know a lot of people out there could use this information.
Absolutely. Thanks for having us. Be well.
Absolutely. You too.